Hi everybody, thank you for joining us today. For those of you who don't know me, my name is Renee Bryden and I am the Director of Learning at Broadreach Healthcare, and I'm also one of the infection preventionists on staff. And with me today is my co-worker and someone I like to count as a friend, Renee Butter. And Renee works for Broadreach Hospice currently, as well as her husband, Gene. He was going to be here with us today, but we decided it would be the Renee show. Just kidding. We'll get him at a later time.
Just double Renee.
That's right, double Renee. So I wanted to take a chance to kind of have a conversation with Renee and Gene and film it and use it as kind of a learning opportunity or just a chance for people to kind of hear Renee and Gene's story over the last year or so. But before we get into that, let's find out a little bit more about Renee. So Renee, how long have you been working in healthcare?
I've been working in healthcare for a while, but I've been working for hospice, for Broadreach Hospice for 5+ years.
5 years, okay. And what is your role with Broadreach Hospice?
I am an aide from Broadreach Hospice. I used to go to different places, but now I am at Liberty Common.
Okay, so Renee is one of the wonderful hospice aides. And one of the things that changed during the pandemic was sort of how your assignment was done. Before, people might have gone from place to place, but we decided it was the best to kind of keep it centrally located. So Renee is based out of Liberty Commons, and your husband is also a CNA, Gene, that we've been talking about. And he's based basically at an assisted living facility in the area for the most part, right?
Yes.
In addition to being a wonderful addition to our community, you're a big part of the local community, I feel like. You and Gene are in Harwich, right?
We live in Harwich, yes.
Okay.
Yeah.
And I know that your family is very important to you, but also your faith and your church family is important to you.
Very important, yes.
Do you want to talk a little bit about sort of your role in the community on Cape Cod or in the church?
Yes, like my family in general, we are Seventh-day Adventists. We go to church on Saturday, as most of you know. And my husband, both of us are leaders at the church. My husband is the first elder of the church, and I have different roles. I'm a youth response director at the church. I am the treasurer of the church, and I'm responsible for a part of the community service at the church. So I have big responsibility at the church as well as in the community.
And you guys also have some pretty amazing children, right?
Yes, we do. We have 2 girls. We're so proud of them. Thank God for them. And they are very active at the church as well. But now that they're not like physically at the church, but they still work at the church. Like when we're having Zoom presentation, Zoom meetings, they're always there with us.
And they're adult children, but
They are, yes.
They're wonderful girls, if I do say so myself. Now, my other question for you is, English is not your first language, correct?
No, it is not.
What is your first language?
My first language is Creole.
Okay. And where are you from originally, or where were you born?
I am from Haiti. I was born in Haiti, and my 2 children was born in Haiti. I got married in Haiti, but as we are here, we are American citizen. Me and my girls, my husband haven't decided to do that yet.
That's news to me. I didn't know that.
Yeah,
okay, she's still in the beans.
Yeah,
here.
he's still a resident, like a permanent resident. Yes.
He's permanent in our hearts, so
Yes.
that doesn't really matter. Okay, so one of the things the reason I wanted to talk to you and Gene is that not only are you incredible people with huge hearts and amazing at what you do, you're really important in your community here on Cape Cod, but you guys have had sort of a different experience during COVID. Whether it was working through the first part of the pandemic. All right, So your experience throughout this whole pandemic has been, I think, unique. Not only were you both working in facilities where there was COVID, and having to go to work every day, healthcare workers didn't get the luxury of kind of staying home and enjoying quarantine. But you guys kind of had a different experience personally. Do you want to tell me a little bit about that?
Yes. I was working at a different facility last May, and I was the first one in Broadridge who got COVID, and I was sick. I didn't get sick enough to go to the hospital, but I was sick. I didn't have fever. I had the chills. I had headache. So I have some symptoms that when I tested, I was positive, and that might break my heart. The whole family, it's like that was the end of the world for us. But at the same time, when we know we have a God that's after us, we believe in God, and we know we were gonna get out of it. And when I got COVID, my husband got tested. He was positive. My daughter was in the house. She was positive. I had a niece who came to visit us, and she was pregnant. She came to visit us for a short amount of time, and she was unable to go back, and she got COVID. So the whole house had COVID. Only one of my daughter didn't get COVID because she wasn't in the house. She was in school.
And you were all sort of symptomatic and sick, and took a while to get better, right?
Yes. And when I got back to work, when I get better, I got back to work at Liberty, and since then I'm here.
Okay. So that was over a year ago. So you guys were among the first people to test positive and were sick, and so now you've been recovered for almost an entire year, and we're still here.
Yes.
Wearing masks.
Oh, yes.
Okay. So then when it came time for vaccinations, because I know I was kind of concerned myself, because I was thinking, well, how is the FDA going to get all this done, and will it be safe? But as they kind of got everything ready and we were getting ready to have the clinics, I know initially that you two were kind of hesitant to get the vaccine. Do you want to tell me a little bit about that?
Yes. My husband and I were the first one. I said, okay, we got COVID. There's no way we're going to get the vaccine. Whatever what they say, we're not going to get the vaccine. And my husband said, no, never. I'm not getting the vaccine. And after that, he said, you know what? I might get it sometime, but not yet. And that's what I said too. I said, I'm still waiting. I might get it sometime, but not yet. I'm still gonna look how things are going. The people who get the vaccine, what's the reaction, and what's gonna come out of them after they get the vaccine.
So aside from having some immunity from having been sick, what were some of your other reservations about having the vaccine?
I was thinking about my religion. And I said, because I'm Seventh-day Adventist, why would I take the vaccine if I know God is protected me? But when I think my God, our God, He's there, He's watching over us. He wants all of us to be healthy. He put doctors around. He put nurses around. He put the scientists around. And if we are here, all of us, I would say us immigrants, to come to the country, we have a lot of vaccine to take. To go to college, to go to school, we have a lot of vaccines to take. So all of those vaccines, they don't have much different than that vaccine. And one other thing why I changed my mind is our church, the whole congregation, the whole conference, they have a lot of presentation, a lot of round tables, a lot of information about the vaccine. They give information about the Pfizer, the Moderna, and the Johnson & Johnson, and they explain everything. And Broadridge Hospice, I remember Bill keeps sending a message, and we had presentation explaining the vaccine, how things were gonna go, and we follow all of those. We get all of those information, And my husband and I sat one day, we said, you know what, let's keep reading, let's keep get the information and see what's gonna come out. We might think of taking the vaccine. And I checked with my doctor. They say, yeah, you have no reason not to take the vaccine. And he checked with his doctor. That was the same answer. And one day I come to Renee, my friend here, and I said, Renee, when can I get the vaccine? What do I do to get the vaccine? And then she gave me all of the information. And then I signed up. She signed me up. I took the vaccine. When I took the vaccine, it wasn't painful. I had headache. On the first day, I was tired, like very sleepy, like I had a little body ache at the first time, but the other one with the second dose, I only had a little headache, and that was it. And just letting you know, my husband and I wasn't the only one in the family who took the vaccine. My first daughter, she took the vaccine before us. And
Leading by
then she
example.
would, yes, and she said, you guys should take the vaccine. And then after all of those information, we decided to take the vaccine.
Yeah. So now I remember, my memory is that you went first and Jean was still a little bit hesitant.
Yes.
So without speaking for him, but we're going to speak for him, what do you think he was hesitating for then, or what finally pushed him to the point to say, okay, let's make the appointment?
He said the first time when my daughter and I keep talking to him, and he said, well, I don't see what the reason not to take it, because if my family is taking it and I'm around you guys, if something happened, I'm the only one who's gonna give you, like, let you expose on anything. So that will be a good reason. And then beside, I got all of the information about the vaccine. Why not take it? And then he decided to take it. But when he took the vaccine, before he take the vaccine, when they talk to him, and then one day he said, oh my goodness, 2 Renees after me.
Double Renees.
So, and then he decided to take the vaccine. But when me and my husband, we took the vaccine, that changed a lot of other people's mind. He got a sister in Haiti. He used to come like here frequently. She said to my husband, if you decide to take the vaccine, I'm coming to take the vaccine too, because he's not an easy person to do those things. If he decides to do it, that's mean it's something that's safe. It's something that we can rely on. It's not gonna hurt you. It's not gonna, because we didn't get hurt. And now that I have the vaccine, I took the vaccine, I feel some kind of safe. Because look what's going on over there. I didn't say I'm not gonna catch COVID again, but because a lot of people who got vaccinated got COVID again, but I'm not gonna like get sick to go to the hospital or die from it.
Right, and that's a really good point. A lot of people are saying, well, why bother getting it? I've already had it, and if I get it again, what good is the vaccine? But part of the vaccine's power is that it keeps the viral load, or how sick you get, it keeps it down.
Yes.
So people aren't getting that sick that they need to be intubated. They have milder symptoms. So there is still benefit to that, even if you've had it before.
Yes.
And people are having these breakthrough cases with the variants. So you touched on a really good point. When people said, "Oh, Jean got the vaccine,"
Yes.
that's the kind of reputation that you have in the community, or that's the kind of power that people don't realize when you're in healthcare. People look to you for answers. They say, "Oh, well, if they're doing it, then I guess it's okay for me too." And sometimes there are people in healthcare who don't realize that they have that power, or that the example that they're setting is that powerful. So that was a really good point that you brought up.
Yes. When he was scheduled to take the vaccine, we were having a board meeting on Monday. At board meeting, he said, "I got a very important point to pass out to you guys. I'm scheduled. A part of my family already got the vaccine. I'm scheduled to take the vaccine on Tuesday." and everybody was saying, "What? You're gonna take the vaccine?" And he said, "Yes, I'm scheduled to take it, and I'm going to take it." But after his first dose on Saturday, he announces that he took his first dose of his vaccine.
Great.
So that was good.
Good. And were people proud of him that he stuck to his word and did
Yeah,
it? Yeah.
yes, yeah.
Good. Good. So all that being said, you guys have now both been fully vaccinated for a while. You've been COVID recovered for a year. You're still working in healthcare. Are you glad that you got the vaccine?
I am. Yes.
So you're glad that you got the vaccine. One of the things that I was thinking about, and I want to ask Gene about his experience, is, I think I know the answer to this, but with the experience you've had in the last year and a half, would you ever want to relive that time, working at the facilities during the outbreak? Gene was in this assisted living all day, every day, in full PPE and space suits, the plastic tents. I don't think that that's anything that anybody would ever want to live through.
Not at all.
And I think people that haven't been through that don't understand how powerful an experience that really is.
Yes.
How scary it can be, just how traumatic it can be. All right, so at this point, everybody's probably sick and tired of hearing my advice. So we're going to ask the other Renee for some of her advice. Renee, what would you tell someone who's afraid in general to get the vaccine?
Don't be afraid, because getting the vaccine is not going to die. It's going to get, I would say, closer to life. In this earth, we cannot say we are safe, but if we know something that's gonna at least protect our health, you should just stick to it. Because I was afraid at first. I was, like I told you before, I was the first one who said I wasn't gonna take the vaccine, but now I encourage each and everyone who doesn't get the vaccine yet, please do. It's gonna help you.
What would you tell someone who feels that their faith in God is enough to protect them and they don't need to be vaccinated?
God is protecting each and every one of us. But at the same time, God put doctors, He put scientists, He put everybody on the earth. God is not gonna come and tell you to take or not to take the vaccine. That's why He put people around you to give you advice, what to do, what not to do.
Almost like God is acting through them
Yes.
to protect you.
Yes, yes.
What would you tell someone who has had COVID and feels like their immunity is enough to protect them?
I would say, if you had COVID and thank God you didn't die, you think that your immunity is enough to protect you, and you think you have too many other things that's gonna prevent you not to take the vaccine, I would ask you to check with your doctor. If you really, really cannot take the vaccine, you have other things to do. But if the doctor say it's okay for you to take the vaccine, you should go ahead and take the vaccine.
Good advice. And I think that's really important too. I think one of the things is that no advice fits everyone the same.
Right.
Everybody's got individual circumstances.
Yes.
But if somebody has true concerns, they should talk to their doctor who knows them best.
Exactly.
And then,
yes.
At this point, I don't know how much everyone knows about the vaccines, but they work in different ways and works in another way, or the Johnson & Johnson. And so what might not work for you with one vaccine might work better the other way.
Yes.
But talk to a doctor or someone you trust if you're not sure. I think that's good advice too. What would you tell someone who English is a second language and maybe they don't feel like they're comfortable enough to ask questions, or they haven't been able to get the resources that they need to truly understand?
They should check if I was like, I have English is not my first language. If I need some information that I don't know, that I cannot get from my language is not enough to ask. I would say right now we speak in English, and I was unable to communicate with Renee. I would look for someone else who speak my language and ask that person what do you think? What should I do? And that person will lead you in the right direction.
Okay, so take advantage of your peers or other
Yes.
people in the community that might have more access or better understanding.
And there is that available on other language. There's other people who's willing to help. We have that at our church, that if you have some concern, if you have some information that you need, you can come to those departments and they'll help you with that.
And I think that even applies to not only English as a barrier, but if someone's homebound or doesn't have the best mobility, there might be somebody that's willing to FaceTime with them
Yes.
or
Yeah.
speak with them on the phone, or maybe again people have hearing or they can't hear people and understand with masks. So there are probably other ways to access that information if somebody has a communication barrier.
Definitely.
What is the one thing that you would tell healthcare workers that aren't vaccinated yet why they should get vaccinated? The top reason, what would you tell them?
What I would tell them, as we work in healthcare, you exposed to any kind of disease because you don't know who you're dealing with. You're taking care of everybody, so you don't know what you're gonna get into. So whatever you think that would protect you, I would do it. The vaccine, it's one of the things that the scientists come for COVID, and COVID is the big thing around the world right now. I would say go to the vaccine. Like we always say, we're not forcing people to take the vaccine, but it's a good idea. If you don't know all of the information, look for all of the information about the vaccine, and once you get it, you will get the vaccine.
Good advice. What are the resources? I know you talked about the different roundtables and meetings that your church had, and you guys sought out your doctor. Are there any other local resources that you can think of that people might be able to take advantage of if they had questions or concerns?
Yes. For my job, we have Renee here. She's a go-to person. She's always available to help anybody. She can help you set up all of your appointment to take the vaccine, because she was the one who helped me with mine because I was reluctant at the first time, and she did that for my husband as well. And I'm telling you, my husband, he was so reluctant to take the vaccine. He didn't get to get the vaccine at Liberty Common because that was so late. He decided to take the vaccine. So when they had to set up his appointment at a CVS elsewhere so he could go take the vaccine. So it's not too late. It will never too late for you to go to Renee if you are at Broadwich. And if you are not, if you want to get some more information, there's any CVS. If you go to any CVS, they will set you for an appointment for the vaccine. And I think Charles too.
A lot of the local pharmacies and grocery stores.
Stop and Shop.
Yeah.
All of those pharmacies will help you take the vaccine.
Good. And there's tons of websites and things, but I think the important thing to remember is that get your information from a good source. So if it's a government website, the CMS, CDC, the Department of Health, maybe not from Fox News or YouTube necessarily, or Facebook even, but I think there's some really good reliable sources that you can look for.
One more thing that some people are afraid of is the insurance. A lot of people are afraid, say if they don't have insurance, they're gonna charge them for the vaccine, or the vaccine is they're gonna ask them for a lot of information. Don't even think that, because they're not gonna charge you for the vaccine. The vaccine is free.
Yeah, that's a good point. Really, all you need is your name, your date of birth, and for the CVS system, you need a mobile number and an email, because you can change the appointment times or even the locations if you needed to. Accessing it with a text, and that's really it. You know, it's you're right. You don't have to give away your private information, and they don't require insurance information either.
And one more thing I heard people say, they said, a lot of people in my community said they don't want to get the vaccine because the government is controlling them. But let me tell you something. The government, if you hear, the government is controlling everybody because they have all of your information. So if they know your address, they know your social security, the government. So that's not the reason not to take the vaccine. Especially us immigrants, when we come to the country, they know everything about us. So don't be afraid of like the government is gonna control you. It's that the vaccine is not the reason why the vaccine is here, for the government to control you.
Good point. There's no microchips in it, I promise. All right. Any other final parting thoughts or comments or stories that you want to share?
No,
All right. Well,
not that anything that I can think of.
okay. Well, thank you for your honesty and for sharing so much of your story. I appreciate that. And I'm hoping that by sharing your experience, kind of covering the gamut of all the different things, that maybe some other people will say, maybe that's not so scary after all. If people have questions and want to talk to you about it more, are you available for that?
Yes,
Okay.
I'm available anytime. If I don't know the answer to it, I will look for the answer and get back to them.
Likewise. All right. Well, thank you very much. And thank you for watching.
You're welcome. My pleasure.
And if you have questions, you can ask either Renee. We're easily available, and we're happy to do that. Thank you so much, and we will see if we can get Jean in some post-production. Thank you.
All right.